Hello, everyone. I'm Dr. Yaron Wu, licensed acupuncturist in California, United States. And today we're going to share to you about the coronary heart disease. People need to do stent and a bypass. What you can do? Another option from Chinese medicine. The thing is this: when someone has coronary disease, for example, the brother or sister did a bypass or a stent, then their own blockage of the coronary, which is the artery of the heart, blockage is less than 50%. What you do? You wait until block like 70-80%, do the stent or bypass, or you can do something to reverse it. Even someone did stent and bypass, they still have a chance. Other artery of the heart, coronary, the artery will block continuously because you did not treat the cause. That's the main thing. So we're going to discuss that today. First, all our information here is try to give you an idea, another option if you want to do, but it's not for you to apply yourself. It's just for education purpose. So it's your own judgment, is good or not, apply to you or not. Is not try to take place your Medicare, your medical doctor's treatment from you. So don't misunderstand this part. That's one thing we have to announce. And if you want to contact us, that's our phone number in the United States, 408-480-2860. And you can go to our website, DiabetesWellnessCare.com. This video will be on the website. And if you're not in the United States, you can contact me by WhatsApp, the same phone number, just search us or search our website, Diabetes Wellness Care. So today's the topic is the coronary heart disease. Before stent or bypass surgery, do you have another option? The answer is yes. So we're going to discuss this one in this video. Hopefully I can give you some different idea. Why we talk about coronary disease? If you don't do stent bypass, the outcome would be heart attack. Actually, it's number one killer. One out of two people in the whole world die from heart disease. Whatever narrow the spasm caused the heart lack of blood supply, then it will have a heart attack or kill somebody. So that's the reason. Why it's called coronary? It's because the artery and the veins of the heart itself, just like this picture, is like a crown, like the crown on the head, the shape. So that's really called coronary artery, which means the artery of the heart. So for the heart, obviously, the artery and the veins supply the whole body, which the heart pumps the blood out to the whole body, and the veins collect or use the blood into the right side of the heart. But the heart itself needs some blood supply, which is called coronary artery and veins, which means the artery and the veins for the heart itself. It circulates for the heart itself and supply nutrition for the heart. But there's one thing a lot of time was missed or did not talk about it, is the lymph node system. We're going to show the picture at the last, which will help to self-maintain and repair of the blood vessel of the coronary arteries. In other words, the lymph node system around the heart itself will repair the heart. We know all the body cells will die in 3 months. We'll replace it. That's the lymph node system do it. Or the artery itself, the coronary artery, will be replaced and maintained by the lymph node system. The artery itself and the veins supply the heart, and the lymph node system support the artery and the veins and the heart for the regeneration. So how the coronary artery provide blood to the heart? Actually, we know we have a blood pressure, the high one 120, 130, whatever, the lower one 60, 80. The high one called systolic, which means the heart start pump blood out. The heart constructed. The blood pressure is high. Second one was when the heart release. or the veins or the blood come back to the heart is when the heart relaxes. The heart itself get blood supply for heart itself, not pump blood to the whole body. Is when the heart relax. So the diastolic blood pressure, the lower blood pressure is high, indicate the heart did not get blood supply. So when the the blood pressure, when we have a high blood pressure, you have the high number, lower number. The lower number is high, indicate the heart is in trouble. When the high number is high, they indicate it's very hard for the heart to provide blood to the whole body. So that's one thing. So if you want to figure out the blood pressure related to your heart condition, watch out for the lower number. When the heart has a trouble, which is called coronary heart disease, there's many kinds. The first is have no symptoms. A lot of people did a stent because the blood test, or my brother, my sister, whoever had it, they have no symptoms at all. I had one patient, the artery of the heart, the coronary artery, blocked 80% without any symptoms. Also, some people can have the pain in the chest. Some people can have a heart attack. There's many kinds. But that one, if you have a family history or you have some symptoms, you need to go see a doctor to do the color ultrasound to test it, to see the structure of the heart. And there are some signs might indicate heart has issue, or the coronary artery is in trouble. The artery for the heart itself is in trouble. First one's edema. It can be liver or kidney as well, but a lot of times it's from the heart, special for senior. Second one's fatigue. Some people mild after day work, I'm a little tired, kind of normal, but you need to check out. Some people want lifting or go upstairs, 2 or 3 floors. I feel my legs so tired, might be a heart issue. Some people even resting have very tired feeling. Then you definitely need to check out your heart, because it might mean your heart itself did not get enough blood supply. The heart didn't get blood supply, so the heart cannot provide enough blood to the whole body. That's when people feel tired. Some people have palpitation, just feel my heart doesn't beat right. Some are dangerous, some are like general, just like exercise or whatever I did too much. That kind is kind of okay, but you still need to check out. But if you have chest pain, dizziness, or no reason, suddenly I just feel, my heart beat differently, you definitely need to watch out. Some people relate to coma dizzy. Suddenly people lost conscious, or they suddenly feel dizzy and have swollen, have tiredness that go up floor 3 or 4 floors. I just feel so tired. Then heart might have issue. Of course, blood pressure, we talk about that one. The lower blood pressure, there's a high one, there's lower number. The lower number high indicate a lot of things to do with the heart. Now, what's the reason caused the coronary heart disease? The heart itself has less blood supply. Number one, aging. But I personally believe that's excuse. Most senior has heart issue doesn't mean when you're getting older, you should have heart disease. But a lot of people contribute to aging as one thing. Second one, the heart itself has not enough blood and oxygen supply, and heart function can decrease. Whatever reason, like high cholesterol, diabetes, all these things can cause it. But that one we're not going to discuss today. We're going to discuss the heart itself. If you need to do stent or bypass, why? This is a normal blood vessel. And this is the illustration when the first 10 years, second 10 years, for most people, the first 10 years won't get like 40, 50. The artery itself getting hard. It's called vascular aging. In other words, sooner or later, the artery becomes more narrowed, especially when people have high cholesterol. Then finally get clots and block the heart or in the brain, cause like stroke or heart attack. And this is the illustration to show actually literally the process. The right side is the normal one and the left one indicate how the artery can be more and more narrowed, and finally no blood can go through. For Western medicine, first thing is promotes the heart's own bypass. or prevent, the vascular getting more aging, or stabilize whatever, the vascular, the hardness to break or block. So Western medicine is treating the outcome, and for Chinese medicine will look completely different. We believe it's reversible. If you know your body can create any problem, your body has the same ability to resolve it. You just need to figure out what's the cause at the first place to make this happen, try to avoid it, to bring it back. This is all the Western medicine. Most time if you see a doctor, you know your heart, or somebody knows their heart has like blockage for 30–50%. They will give you all the medicine, try to increase the heart itself, the blood supply, and slow down your heart rate, stabilize the plaque, whatever. And Chinese medicine look a little different with treating the cause of the clotting. And we're going to talk about more later. For treatment, if there's blockage for the coronary artery, the artery of the heart is blockage, what are you going to do? So there's one called PTCA, which means we put a balloon or whatever inside, make it bigger, or put a stent, make it bigger, or bypass. Bypass is mostly the artery is completely blocked. You take an artery from somewhere from your body, just put that artery next to the heart to bypass, so the heart can still get blood supply. The side effect of this, or downside of this surgery, is number one is high cost, obviously. Hopefully most covered by insurance, health insurance. Second thing, there's 15–40% reoccur. In other words, you treat the blocked artery of the heart, put a stent, or you do a bypass, whatever is completely blocked, put another artery there. Lucky enough, today we have such great science and surgery, we can do that. But did you treat the cause of what caused this problem at the first place? If you didn't treat the cause, the other artery can be blocked too, because the process is still going. So the most patient I got was 7 stent in the body. But how about other one? Here is an image to show, the blockage 90% here. I can see here the red arrow on the left picture is like almost no blood flow. It's like right side is try to illustrate what happened there. And what you can do, one surgery is like a PTCA, just put a balloon through your artery all the way to there. Just, the balloon, pump the air, make it bigger, expand it. Or like this kind called stent, just implantation, just put it in, make it open, and some put some medicine as well to absorb the local blockage. And after you do the surgery of stent, this is the picture before and after to compare, the artery getting back, circulation come back. That's what's going on. So the surgery itself is great. When you really, really have it, you need it. And this is another kind, use the rotation, try to open it up, shape it off, whatever the blockage. So that's the illustration for the treatment. That's how you do it. So you put something literally in to do the surgery. What we're going to discuss today is, when you understand this surgery, can we do something naturally reverse it? Especially if you're not qualified for a stent or bypass surgery, like only have 50% block it, and I have no symptoms. Most of the time the doctor won't do it. But what are you going to do? Wait until block 70%, 80%? Doesn't make sense. So this is literally our real heart. You can see the left side, the artery, right side artery. It's kind of pretty thick and big. Can you imagine that one be blocked by decades? And this is a picture too, outside the heart. You can see the artery, the red one. So this is a picture just to illustrate what's going on. The artery for left side and the right side, the heart itself, the blood supply. So for the heart itself, the blood supply, the right side mostly is from the right artery. The left side, 50% from the artery of the left side. We see the pictures, 2 arteries go left and right. Right side is complete supply, the right side. Left side, 50% from the left side. There's 20% from the right side and some in between. There's one circle around. So we ask as Dr. Wu, and my heart artery is blocked, what are we going to do? In Chinese medicine, anything we treat, only two kinds. One we call yin yang. Yin and yang, if you see the picture, black or white, and we call it black or white fish, that one. That actually indicate when things is too much or too less. If I apply to the heart, which means the heart has too much blood supply or too less blood supply for the heart. Another thing is called balance, 5 elements. Some of you probably heard about it. That indicate for your 5 elements, the 5 organs, your kidney, your heart, your lung, your liver, your spleen, all the 5 organs, when one have enough or too much blood supply, the other one has less. In the body, if you want to be healthy, you need to be balanced. Everybody need to get enough, adequate blood circulation. You cannot get too much, which causes inflammation, or you get too less, which the organ will have less function as normal. So Chinese medicine always try to treat this one. For a specific organ, you have too much or too less. And a too much or too less blood supply is come from other organ, has too much or too less, so affect us. Same thing. That's the reason Chinese medicine called holistic. If you say, oh, I don't understand what's yin and yang, and this is the picture you illustrate, which is the autonomic nerve system. Most people, if you learn anything about biology, probably saw this picture before. One side, on the right side, is called sympathetic, which make your body have a high blood sugar, high blood pressure, be ready to fight or wrong stage. The left side, which calls parasympathetic, which make your body calm down, relax. For your heart, when the sympathetic is working, your heart get more blood supply, your heart rate go up. And when the parasympathetic, which when you fall asleep, relax, take a deep breath, your heart get less blood supply, or the heart rate goes down. Actually, the heart get more blood supply. Sorry. When the body supply more blood to the body, the heart itself get less blood. But when your body relax, the heart get more blood supply. So in Chinese medicine, the yin and the yang indicate, in this case, for the heart, indicate the heart get too much blood or too less blood. Actually, every single organ, any health problem, you can apply this one. The sympathetic or parasympathetic, which one's in control? If an organ is swollen, too active, sympathetic, we call it yang is too much. When an organ is not function, it's less. So if you can balance it, figure it out, you can treat it. In Chinese medicine, there's many ways to predict if the heart is in good condition. For example, this one, I do a circle on the arm called PC6. P as people, C as a cat, number 6 is acupuncture point. You can Google it. That area is the typical point to treat heart condition, like palpitation. If people here, the PC6 area, like the people, the left side is a normal kid, normal arm. The right side, you can see a lot of veins. That area has a lot of veins indicate heart circulation is in trouble. Not necessary for heart disease, but indicate the heart itself has issue. Or you can look at people's tongue. Like the circle, I circled the left side and the right side, indicate the heart area, lack of energy. And the front part, if you see somebody's tongue like knife cut off, not a circle shape, or a dip go inside like this, that indicate people has a heart issue from sleep. When people lack of sleep, the heart did not get a rest. So Chinese medicine believe the heart is like engine. It's not like overnight your engine will worn out. It's by decades. When you drive 10, 100,000 miles, the engine slowly worn out. All the signs I'm trying to show here indicate your heart, like engine, worn out process. When you get to put a stent or put a bypass surgery that time, that's too late. This heart is worn out already. So what I try to show, there are many signs can indicate a heart is in a degeneration process. And for some people, you look at their heart area, there's a dip on the top. This area is the heart area on the navel. So in Chinese medicine, any kind of health problem, we look at your sleep, your diet, your exercise, and your stress to figure out what kind of condition in your lifestyle cause certain problem and contribute to your disease. For example, cause called weakness, the metabolism rate goes down. Coldness, the circulation slow down. Tension, we call blood stagnation, like a holding fist, body tensed up. Or dampness, when body cannot process for the metabolism, the trash left over in your body. Most common one is the big belly. So all this outcome will contribute to the symptoms or disease, include coronary artery, coronary heart disease. The heart get trouble. So for example, we believe the diet, we eat junk food, deep fried food, milk, cheese, raw food, cold stuff, will cause dampness and coldness, which is very hard, very bad for your heart. Or stress, like tensed up. Your body tensed up, the heart need to take more effort to pump the blood to supply the same blood circulation. When people don't sleep, you have no time for metabolism, the body getting more weak. And in the night, your heart rate goes down 40%, which is a resting time for your heart. Your heart cannot complete rest, like zero, no. But it's a slowdown. If you don't give your heart enough sleep time for resting, you make your whole body weak and make your heart weak. Another one's exercise. A lot of people exercise wrong, which means you don't warm up or cool down enough. Why you need to warm up or cool down? Because when you start exercise, run 100 meters, suddenly speed it up. Your heart rate cannot catch up in a second. The heart need to take a time to speed up. So suddenly, even your heart pump blood, it cannot go to the muscle you are running because there's big artery, small artery, microcirculation take time. Most time take 10 to 20 minutes for the blood to go where. So especially for senior, when you run, like 40 years old, 50 years old, I run, oh, my leg strained. Why? Because no blood go there. So after you run 20, 30 minutes, your heart rate start go up, your muscle constructed, the heart send blood, the muscle send blood back. You become a loop. You play football, you play baseball, whatever, suddenly you stop. The heart is still in a heart rate, fast pumping, but the muscle doesn't squeeze anymore. So the blood always go to the muscle, but no blood coming back. Chinese medicine called blood stagnation. You touch the muscle, feel a little stiff. So wrong exercise or no exercise is number one reason cause heart issue. And I find out a lot of people go gym, exercise all the time, actually have more common the heart problem pulse. In Chinese medicine, if you want to be healthy, the blood need to be in the belly. Why? Because all your metabolism, when you eat food until you get out, because we know nutrition is the thing supply us to live, plus the oxygen. And the nutrition processing physically or chemical wise, all in your belly. So blood in your brain, you're smart. Brain, you go to gym, your arms and legs become bigger, you're strong, but nothing to do with health. When you need to be healthy, blood need to be in your belly. So exercise good, but slow exercise good for heart, not heavy exercise. And the heart in Chinese medicine is life and death. So when people has, that life habits, sleep late, a lot of stress, tensed up, lift weight, no exercise, heavy exercise, eat raw food, cold food, all these things can contribute to a heart issue. And the science can indicate palpitation, chest pain, the upper back, T3, T5, cold, tired, or pain. Chinese medicine called the backside of your heart. Is exactly on the back of your heart. Or anxiety attack. People suddenly lost conscious, cold sweat, send an emergency, check all the heart rate is good. Doctors say you're too stressful. Anxiety attack. Chinese medicine believe that's a functional heart attack, just like a car. When you have it loaded, go uphill, the engine shut down. But you turn on, the engine still can work. If you cannot turn on, engine broke, called heart attack. When the engine only turn off, but it can turn on again, it's called anxiety attack. It's a functional when you're still young, your body is overloaded for your heart. So the heart stop function for a second to rest. Some people have swollen fingers or pericardia, which is the middle, which we showed the PC6, the point around here has the veins or press very tender, or some people feel chest pressure during sleep, night sweats, cold hand, cold feet, which indicate heart circulation no good. This is the one, the PC6, or joint, knee or the elbow or fingers or shoulder pain in the night or in the morning. Or some people have severe nightmares, jump off cliffs or on the airplane suddenly drop. That can indicate a heart issue in Chinese medicine. Or numbness in the last two small finger, the ring finger or the small finger, because this too is the heart channel. Or chronic left side shoulder and upper back pain, because this one, even Western medicine believes there is a sign the heart has trouble to radiate to the left side shoulder, because you cannot feel your heart, but your left shoulder can feel it. If it's a chronic pain, that might be the reason. Or as we showed a tongue picture, the tongue can look at it. There's a dip in there, or the navel, the top is cleft, or the ear has some lines in Chinese medicine indicate a heart issue, or the lips, very black, like liver color, the lips. If you compare it to a teenage girl, the pinkish lip color, the lip is the only place can see the internal circulation. Or when we check your pulse, we can tell your heart has issue. And this is the feedback in 2010 from my patient about heart issue. I've been treating heart issue long time. And that's what basically the guy is saying. He got some herbs. After 2 months, the mom feel way better. The mom was confirmed by the doctor has coronary heart disease, and he want to order more. After 14 years from 2010, my treatment is way better than before, because I literally can touch the body and feel where and what's the reason cause your heart issue. And this is the reflection point. When you have a heart issue and touch around the chest, there's some point I feel very tender. Most patients, when I check it, they don't know. Like, oh, I never know my chest here press hurts so much, but that indicates a heart. So when you massage that one, can help the heart circulation as well. And it also can do acupressure. The left side is the heart channel. The right side is what we call PC, pericardium channel, which is around the heart to protect the heart, that channel. Or you can do moxa heating therapy. Moxa is the top MOXA, can Google it, has been used in China for 3,000 years to improve the circulation. Obviously, heart issue is a circulation issue. So this one is very useful. In our clinic, what we do is just put 2 pots on your belly to speed up the belly circulation. So when your belly, the metabolism speeded up, your heart has less effort to do it, because 40 to 50% of blood circulation every day is supply your metabolism. If we do moxa heating therapy to speed up your metabolism, your heart has way less effort. And as a feedback, your heart itself get the nourished and help the circulation for the heart itself to release or resolve the blockage or clots for the heart itself as well. That's what we understand as Chinese medicine. So when we do treatment, we do the CV8 and CV4. If interesting, you can check online, Google it. Support heart, the healing therapy, the moxa. Also can do the moxa, the healing therapy on the back of the T3, T5, which is the backside of the heart. The reason is because that's the same level of the heart. And if you look at the anatomy, the front part called sympathetic trunk, which control the heart blood supply. We cannot do acupuncture there because that's right next to the heart in front of the spine, but I can do the back, the small branch of the nerve. And anatomy wise, when stimulate the back and the front, the body reacts the same. So you can do in the back for the treatment to help the blood supply. For some people, the palpitation is from neck problem, but that one's easy. You do x-ray or you come to clinic check. It's not typical for the heart issue, but which is from neck issue caused the palpitation. This you just need to figure out it is or not, but it's nothing to do with put a stent or blockage. So when we do treatment, Chinese medicine is try to improve blood circulation for the heart and do tension release. Whatever your body structure The heart is just hanging there next to your spine inside your chest. So when your chest, the shape, literally the structure, turning or twist, it can make your heart circulation trouble because artery and veins, whatever, be pulling. That one, when you come in, will touch your body, will check the tender point, will release it. You can feel, wow, I can take a deep breath and breathe way better. And also, we give herbs to help the circulation of the heart. And also, when we check your body, we can tell you the lymph node in your body, there might be some disorder, blockage, whatever. That one, when we check it, we can tell you. So in Chinese medicine, believe the phlegm or the blood stagnation, whatever the reason, caused the artery blocked for the heart. And the last 2 years, I finally figured out the lymph node system was the one big contribution. And it's hardly talked by MDs, but for now, we literally can touch your body to feel that and release it. A lot of people can see very interesting outcome. This is the lymph node, the green one. The red one is the artery. We can see the picture. This is an anatomy picture from Western medicine or from science anatomy. You can see literally all the lymph node almost followed artery. Every lymph node also in charge of regenerate the heart and artery. The artery of the heart need to be maintained by something to keep it regenerate and function well, which is the lymph node system. So in your body, 90% blood and nutrition oxygen is supplied by artery and vein, but there are 10% supplied by the lymph node system. And which in the last few years, I figured out there might be a trouble when people are stressed out. So let's look at this. For your heart, if left side, the heart is blocked, it's because the left side heart, the lymph node goes to the right veins under subclavian, the bone, the clavicle bone. So when that one's blocked, when we touch it, you can feel it. So left heart relate to the right side lymph node system. The right heart relate to left side. This picture shows you where to go for the heart. So as normal, this is the one thing I personally believe why Chinese medicine believe the dampness, which is the protein or fat, whatever the thing spread in your body cause the problem. As normal, the pathway for any protein, like you eat a seafood, you eat a rice has 10% protein, or in the tofu, or any kind of food you eat, it come into your stomach, intestine. So your body will absorb it through the veins or lymph node system. It goes to the vein, sent to the liver. The liver will clean it. You know, the protein has many kinds. COVID-19 is protein, bacteria has protein, seafood has protein, rice has protein, tofu has protein. Anything other than your own body, the protein is called outside protein. The outside protein need to be processed or cleaned in your liver. This is a must to do process. So just like immigration, anybody come in, we need to figure out, it's United States citizen, okay, you go. You have green card, come in. Your immigration, when you check out. Your drug dealer, when you send to jail. Liver does that job like customer. So after that, the liver send blood to your heart, the right side heart. Then your right side heart pump to the lung get oxygen, then send to left side heart, and the left side heart send to whole body. But when you're stressed out or in an emergency condition like fire or whatever thing make you too stressed, the food come in, stomach, intestine, same thing. But the veins sent to the liver will shut down because that time the liver try to create more sugar, whatever nutrition to supply the whole body for the stress or emergency condition. Have no time for processing the food, the outside protein. Then the uncleaned or undigested protein or fat will bypass the liver, send to your heart through a vein next to your spine. And this have too much not clean protein or fat, blood come to the right side heart. When the heart gets too much on the right side, it has a right side heart blockage. And sent to the lung and come back to the left side heart, the left side have trouble too. So the abnormal protein spreads all over the body, which is a typical case for food allergy. Like people eat seafood, they have allergy because that food was not processed in the liver, but bypass the liver, go over the whole body, then the body has allergy, food allergy. So when people are stressed out, the blood from the stomach or intestine, which absorb the protein and the fat, actually every day there's 70 gram to 200 gram protein and 80 to 90% fat will go through the lymph node system, very interesting, to your liver, be processed. And when you stress out, this one's not done. That's what happened. So this one indicate in Chinese medicine how we believe why we need to do tension release, unlock the whole body, help the circulation, release the tensed up stage. Whatever your body, doesn't matter, lymph node system or muscle structure, whatever tensed up, will unlock it. Number one, help the heart itself. The heart, when everything is relaxed, the heart has much easier. Just like a holding fist. The heart gives the same blood supply to a holding fist or to an open hand. Open hand, obviously easy. Second thing, in the relaxed stage, the lymph node system can function well. Your liver can function well. Then the blood can be filtered in the liver for all the outside protein and fat, which we call dampness. Then it won't store in your heart, doesn't matter left side, right side. And when you come in, we check your cracked bone or check your chest, a tender spot, most time you can feel it. And most people has a heart issue blockage. Here, the big circle, the red circle. This is the one, the gathering of all the lymph node system of your lower limbs and your belly. A lot of people here has a huge blockage. When I touch it, you can feel it, stuck. And some people on the left side, cracked bone here, you press it, very tender. The lymph node, here's the place the lymph node get into the veins. The body collect the lymph node. This one's tender. If this one's tender, the right side heart is in trouble. If the right side cracked bone on top, the vein place is tender, left side heart is in trouble. And all these signs indicate something going on. As long as we touch your body, we can feel something, you can feel something, we release it, your body will be way better. That's the way how we reverse the blockage. And by plus the herbs, which I did like over 20 years already to help people with a heart condition, plus moxa to support your body. So we make your metabolism better instead of for your heart, work hard. Your heart can have a rest and use the moxa, the healing therapy, to support your blood supply. That's how we treat heart disease. So if you have a blockage like 50%, 60%, the doctor say you have no symptoms, you're not qualified for stent or bypass, you should consider Chinese medicine. Come in, get a free exam, we'll check your body, can feel it. Second thing, even you did stent and a bypass, it's not a safe answer forever because the cause, which the lymph node system blocked, stuck, or too stressed, body too tense, the cause, the reason is still there. So the blockage will be blocked for the coronary artery, the process is still ongoing. In that way, you need to consider in the future, are you the one of the 15 to 40% reoccurred patient? You don't want that one keep on going because next time it's not a heart block, might be the brain for a stroke. So a lot of time I tell people, can you predict your health in 5 years? Because everything for health problems is accumulation, just like money. How much you spend, how much you make, 10 years later, decide if I have a good retirement. If you keep on going 30, 50 years, decide if I become millionaire. If I keep on spending more, all the cost of whatever the spending for health is there, and I have no way to reverse it, of course the health go down. So there is natural way. Chinese medicine has been applied over 3,000 years. all the herbal formula I prescribe to my patient has over 3,000 years history. But fortunately enough, today we have all the lab tests, the image, MRI, ultrasound can show us what happened inside the heart, and we can compare before and after. So if anybody interested to reverse your blockage with coronary artery disease, the heart issue, contact us. We offer a free exam. I will check your body, you can feel what's going on. I will explain to you in person what we can do, how we do it. So if you're not qualified for surgery, or you did a stent or bypass, but you still have some symptoms or worry about the future, come to us. Whatever you do today will decide your future health. So that's the whole concept for coronary heart disease. So if anybody interested, I'm Dr. Yaron Wu, and you can go to my website, DiabetesWellnessCare.com, or contact us by text or call us for a free exam. We hope you have the best health, and whatever you do can contribute to your future health. Thank you.